Good evening and welcome to our virtual community event for vision correction surgery hosted by Bondi Eye Doctors and SMS Vision. I'm thrilled to introduce to you our speaker, Dr. Patrick Versace, one of Australia's most experienced refractive surgeons. Dr. Versace was involved in introducing laser eye surgery technology in Australia and has more than 25 years of experience. Dr. Versace is committed to educating the next generation of ophthalmologists with on-staff appointments at Prince of Wales Hospital and a teaching appointment at University of New South Wales. Most recently, Dr. Versace is a founding doctor of Bondi Eye Doctors with dedicated consulting suites and purpose-built laser eye surgery suite in the heart of Bondi Junction. During this session, Dr. Versace will provide you with an insight into who is appropriate for vision correction surgery, how to prepare for vision correction surgery, and what to expect following vision correction surgery. Following this, there'll be time to have your questions answered. Please post these in the question box and Dr. Versace will answer these. For the purposes of this webinar, all attendees' microphones and cameras have been disabled. However, again, please post your questions in the box, and if we don't get to everyone this evening, our team will endeavour to answer these tomorrow via email. Please be aware that any information presented in this session is of a general nature, and please speak with your treating healthcare professional before implementing anything or any program or advice. During this session, if your screen freezes or the presentation freezes, please move the cursor on the screen to reboot this, or simply log out and log back in. If you do need further support, you can contact me on 0433 971 603. Thank you for your time, and I'll now invite Dr. Patrick Versace to begin his presentation.
Natasha, thank you so much for the introduction, and welcome to all those people out there that I can't see. I appreciate you coming along and taking some time to join this symposium. The idea of doing this, from my perspective, is just to give you a fairly easy and non-threatening way to find out a bit more about vision correction surgery. So hopefully, as we go through for the next 25-30 minutes, you'll be able to get a bit more of a sense about what vision correction surgery is like, why you might do it, why you might not do it, how you go about choosing what to do, and how it works. So let's go. Now, I've titled the talk, of course, Vision Correction, but in some ways you could also subtitle it, What Are You Afraid of? This is an interesting thing. You have to wonder why everyone is not rushing out to do laser vision correction surgery when it means you can function without having to wear glasses and contact lenses. And when it comes to it, we're all kind of afraid of various things, and we'll go through that in this talk. There are many ways to achieve good vision. Now the world's population, a lot of people out there are short-sighted. More than half the world's population should or do wear spectacles. That's a lot of people. And the incidence of myopia specifically is increasing dramatically in the world's population. So this is a problem both for function, for people being able to function without being dependent upon spectacles, but also an issue of high myopia being a potential sight-threatening problem with the eye that we need to address. Modern lasers can provide a great alternative to wearing glasses and contact lenses and give results that last long term. And again, we'll cover some of this in this presentation. Laser vision correction surgery is not a new idea. For at least 80 years, people have been looking at different ways to change the focusing of the eye by modifying the shape of the cornea. It was actually a Polish priest way back in the 40s who started fiddling with this concept. Why was a priest doing it? I don't know, but he was a thinker. And that kind of led to the idea of radial keratotomy, which is that middle slide you can see there, where we use a diamond knife to make cuts in the cornea to allow it to change its shape. And that led to this Russian technique of radial keratotomy. In the bottom picture on the left is a kind of lazy Susan, where all the patients were laid down on beds on a rotating wheel. They had a whole lot of surgeons lined up around the room, and the patients would rotate from surgeon to surgeon, each one doing one step of the operation. This was the production line refractive surgery Russian approach. It worked, but happily we've got better ways to go about this now. Lasers were developed, and interestingly, IBM was very involved in early laser development, and lasers still have a big role to play in the etching of silicone chips and computer chips. Zeiss is a leader in manufacturing lasers. They've been involved in lasers for treating eyes for many years. And LASIK, the bottom right photograph, is a procedure that really brought laser vision correction to the masses as being a fast and effective and successful intervention to correct the short-sightedness, long-sightedness, and astigmatism. There are many ways we can correct the focusing with the eye. We can put a new lens inside the eye. For example, when we do cataract surgery, we replace the natural lens of the eye with an artificial lens, and this works really well. We can do things to the cornea, and of course it's on the cornea that we're doing our laser vision correction surgery. What we're doing somehow with a laser is changing the curvature of the cornea to change the focusing power of the eye. Let's go back to some basics and talk about visual problems. So myopia, short-sightedness. In myopia, the eye has too much focusing power. So the light is focused too quickly and is not in focus on the retina. The way to treat myopia is to wear minus-powered glasses or contact lenses. Minus-powered because they reduce the overall focusing power of the eye. The opposite is hyperopia or long-sightedness. In this condition, the eye does not have enough focusing power. So again, we use glasses, and these are plus-power glasses to add to the overall focusing of the eye to get the image in focus on the retina. People with hyperopia or long-sightedness often don't start wearing glasses until they're older because they can use the natural focusing muscle of the eye to help overcome the lack of focusing power. Astigmatism is the third element that we deal with, and with astigmatism, everything is out of focus because light is not focused symmetrically. If you can imagine the cornea, the front of the eye, if it's perfect, it's shaped something like a soccer ball, so a nice, symmetric, regular shape. It focuses light evenly in all directions. But with astigmatism, it's more like a rugby football. So a different curvature in different directions, so it focuses light differently. Again, astigmatism can be corrected with contact lenses, with glasses, or with laser vision correction surgery. When we talk about laser vision correction surgery, there are a number of ways to go about it. In the end, what we're doing is changing the curvature of the eye. We're correcting the curvature of the eye at the cornea, the outermost layer of the cornea. And by changing the curvature, we can correct for short-sightedness, we can correct for long-sightedness, and we can also correct the irregularity of astigmatism. So that's laser vision correction. Now what I'm going to go through is details on different ways of delivering that treatment to the eye. So the first technique, PRK, photorefractive keratectomy, has been around since the late 80s. So this has got a long history. And with PRK, we're working on the very surface of the cornea. So we remove the surface layer of cells, reshape the underlying cornea with the laser, and then it grows back by itself. And this works very well. It is still used. Its main downside is that it takes longer to heal because we're not preserving the surface layers of the cornea. It'll take a week before vision really starts to become good again. Next, we have LASIK. And LASIK is a very common and popular procedure because it's fast, it is pain-free, and it heals very quickly. So by the next day, most patients are going to be able to see close to 20/20 vision. There is no real downtime with this. With LASIK, we are preserving the surface layer of the cornea. By removing that, there's a thin flap that we take off the surface of the eye before we use the laser for reshaping of the cornea to correct the focusing. At the end of the operation, that flap is put back in place, so the vision is restored very quickly. The most current technique, and this is a very exciting keyhole technique of surgery, is called SMILE, small incision lenticule extraction. And this is a technique whereby we leave the surface of the eye basically untouched. We're using a keyhole surgical approach to go inside the cornea itself to correct for the focusing. The benefit is that we leave the surface of the eye intact. So there's no downtime. You don't have to worry about rubbing or poking the eye. There is no flap to dislodge. And importantly, the surface layer, the ocular surface, is intact. There are less issues with dry eye and things like this. That's SMILE surgery. So here's PRK, the first technique I described. It's been around for almost 30 years. And with this technique, we just remove the surface layer of cells. We apply the laser to the cornea to reshape the curvature, to correct for the focusing. And then we put a protective bandage contact lens onto the cornea to protect it whilst that surface layer of cells grows back. And that will take about a week. It's a great technique because it's relatively simple and it's relatively non-invasive because we're not going as deeply into the cornea, but it takes longer to heal. It's a bit more uncomfortable, and there's a limit to how much we can treat with this technique. So that's PRK. LASIK has been the mainstay of laser vision correction surgery for many years now. There's been at least 40 million procedures done around the world at our best estimate. With LASIK, we're actually removing a surface layer of the cornea and preserving that as this flap. We then go and reshape the underlying cornea, and then place that flap back into position on the cornea, so that when you leave the operating room, the eye is basically intact and you can see pretty much straight away. Now, clearly we've disturbed the surface of the cornea, even though it heals, but it has the benefit of being fast. And most people by the second day after surgery are seeing close to 20/20 vision. We'll talk some more about techniques of laser. As you go to these talks and you look at people's websites and read about it, everyone will talk about the celebrities they've treated or the celebrities that have had surgery and hold this up as a way to sort of say surgery must be great, so you should do it. And yeah, that's true. I guess plenty of famous people have had surgery and people that matter. We know NASA, for example, has adopted laser vision correction for astronauts. They are allowed to and encouraged to do this to get them out of their contact lenses or glasses. So for sure, it works for many people in many walks of life. But you know, let me tell you about a real person. There's a guy who 20 years ago was very active, keen with water sports, particularly windsurfing, been involved with windsurfing because it was a new sport. Young family, lots of long haul travel, and short-sighted. Now, contact lenses were just not really compatible with this kind of lifestyle, to be honest. And like all of us, the contact lens wear was not a very healthy pattern of wear. So the lenses were worn for longer than they should have been, because who wants to have to go to glasses if you're trying to windsurf? The tolerance of the lenses was actually decreasing because there's some allergies and GPC developing. So the lenses could often only be worn for a few hours before they had to come out. So there was motivation not to be wearing contact lenses or glasses. So he went ahead and did LASIK about 20 years ago now. It went well, and vision has been amazing. This person is now a little older, into the 60s, and so has to wear some reading glasses sometimes for small print or things up close, but still retains perfect vision without spectacles. Needless to say, that person is me, and I love to show this photograph. I love proving what it was like on days like this to be on the water. That's me. I had LASIK about 20 years ago, and it's just fantastic. I always thought there would be some kind of compromise in doing this, that my vision somehow would be compromised, but I would have accepted that. But the reality is that there's no compromise. I just have normal vision. Now, I am a little older, and I do need to wear reading glasses sometimes. There are things I could have done when I had my original LASIK to have avoided that, but I chose not to. If I was having my surgery today, I would probably do SMILE for the benefits of having an intact surface of the cornea. But if I was having surgery today, I would also consider laser blended vision. This is eyes technique that allows us to expand the range of focus with the eyes that minimizes the need for reading glasses. I spoke earlier about myopia and hyperopia and astigmatism. Well, the other thing we should really mention is presbyopia. Now, I don't know who's out there listening to me, but anyone touching the age of 50 will know what presbyopia is. Presbyopia means the loss of the ability to focus for things up close, and it happens to everybody. This is universal. We treat it by wearing reading glasses, of course, and that compensates for it. But we now have surgical techniques that will compensate also for presbyopia. So somebody like me having laser vision correction, I would opt to have laser blended vision, which will mean I minimize my need for reading glasses if I need them at all. For other people, a better technique is to put a new lens in the eye, like a multifocal lens implant. Just depends on the individual patient. So that's LASIK. Now, for the last 8 years, we've had access to this latest technique. This is SMILE, small incision lenticular extraction surgery. So we're still talking about laser vision correction to correct for short-sightedness and astigmatism specifically. But this technique allows us to do the surgery through a keyhole. Let me show you a video that explains how SMILE works. with SMILE surgery. This is done with local anaesthetic. And what it stands for is small incision lenticule extraction. So we're able to remove a lenticule, which is a lens, from the eye through a small incision without much disturbance of the eye at all. Local anaesthetic drops are placed on the eye, and this completely numbs the eye. Now, people are very concerned they're going to feel something or see something, or surgery is going to be painful, but the eye is completely numb with the anaesthetic drops. So the only sensation really is one of pressure and lights moving around. Now with SMILE surgery, the laser is being used not to cut. This is not like a lightsaber going zzz, zzz, and cutting bits of tissue off the cornea. It's firing thousands of pulses of energy into the eye, and each pulse forms a tiny gas bubble which just separates layers of tissue. So it's a very elegant and sophisticated way to create a shape within the cornea that we can then remove through a tiny incision that requires no sutures. And this whole procedure will take around 5 minutes to do for each eye. Now this bit looks a bit gross when you look at it from the surgeon's side, but it's a very elegant and neat procedure. And what the patient's experiencing here really is a sense of a bit of movement, maybe some lights moving. There is no pain. You just can't feel it because of the anaesthetic drops and the sort of twilight anaesthesia with a bit of Valium that reduces any anxiety that may be there. So SMILE has been a wonderful advance on laser vision correction surgery, allowing us to do treatments with minimal impact on the strength and integrity of the surface of the eye, and importantly, minimizing the problems that we have experienced in the past with things like dry eye. Dry eye after laser vision correction surgery is a very common thing that occurs, so that at least a third of all our patients will experience dry eye that will require treatment after normal laser vision correction surgery. With SMILE surgery, it's much less of an issue. SMILE is becoming quickly the standard of care for places that can afford to buy the lasers. To be honest, it's very expensive. It costs you the same. We charge the same for SMILE as we do for LASIK, as we do for PRK. We think you've come to us for an outcome and you don't really care how we do it. But around the world, there's been at least 5 million SMILE procedures now. It's changing quickly. The slide's already out of date. 5 million treatments with SMILE laser vision correction. So this is now a well understood, well-entrenched treatment with a lot of clinical data to show how it works. I'm very keen on SMILE. I love this idea. And at Bondi Junction, we have a SMILE laser as well as a laser for doing LASIK and PRK. So we can do all of these treatments, but SMILE particularly is a very exciting and successful intervention for vision correction surgery. That's laser vision correction. And for a lot of people, laser vision correction is perfect. This is fast. You come in, by tomorrow it's finished, and you have your vision. But there are people for whom laser vision correction is not ideal. Maybe there's too much treatment needed. Maybe there's something funny about the cornea. And there are even patients now who come to me who say, look, I know I can have laser vision correction, but I prefer this operation, the implantable contact lens procedure. They've heard about it somewhere or done their research and read about it with Dr. Google. And they're attracted to the idea that this is additive surgery. So instead of doing laser where we're removing bits of the cornea, we're chiseling them away, with the implantable contact lens procedure, we're taking a lens, a little bit like a contact lens, and surgically putting it inside the eye. A procedure that takes 8 or 10 minutes, so a very simple operation by placing a lens in the eye. Let me show you what this looks like. So with the implantable contact lens procedure, we again are using local anesthetic drops on the eye. And what we're aiming to do is place this lens inside the eye so that it sits behind the iris in front of the natural lens. It's a very elegant operation. There's a very sophisticated and beautiful lens. It's been 25 years in design and perfection. It's been in use for 25 years. In its current form, it's now very stable and predictable as a procedure. So with local anesthetic drops, we enter the front part of the eye again through a small incision requiring no sutures, place the lens in there and place it behind the iris, behind the coloured part of your eye, so that once this is done, you don't feel it, you don't see it. And then we align the lens in an appropriate way so that it corrects for any astigmatism that you may have. The implantable contact lens can treat short-sightedness up to about -20, which is pretty extreme. It can treat long-sightedness, and it can also treat astigmatism. So it can pretty much treat any condition that causes visual function to be less than perfect. So this operation will take maybe 8 minutes per eye. The slowest part is getting the lens. Often the lens will be manufactured, specifically custom manufactured. We pretty much only use the lenses out of Switzerland. There is now an Indian version of the lens, which is less expensive but has a much shorter history. We use the one from Switzerland. It takes a bit longer and it can be more expensive. So implantable contact lens surgery is a wonderful procedure for people who have bigger refractive correction, more astigmatism, or more long-sightedness, or perhaps they have problems with dry eye. The implantable contact lens is a wonderful procedure because it's additive surgery. I'm adding this lens to your eye, which means I'm not weakening your eye, and it also means I can take it out again, so that if I want to change it or it's something not perfect, I just take it out and your eye is back to where we started. That's a very advantageous thing to be able to do in any kind of surgery. So in my practice, I'll use implantable contact lens for any patient who has more than about -6 diopters of myopia. So as you get to larger levels of short-sightedness or hyperopia, but also for some patients who have decided they like the idea of having a reversible and additive procedure. And they get that, and they actually want that, and they understand the sort of optical correctness of a lens implant rather than laser reshaping of the cornea. So with all this, why does anyone still wear glasses? If these things work so well, and they're so predictable, and they last long term, why wear glasses? Well, you know, in the end, I talked to a lot of patients over the last 25 years I've been doing this sort of surgery. People are afraid, and I get that completely. And if they don't tell me they're afraid, or they're fearful or anxious, then I bring it up, because of course they're fearful and anxious. People that understand what's about to be done to their eye, sense of anxiety around it. It's natural. And sometimes this is the barrier that stops people going through with surgery. Even though they've decided they would like to do it, they're motivated, they've decided they really have 1,000 reasons why they don't want to have to wear glasses and contact lenses anymore, but they're afraid, and this is a barrier. Now with surgery, you're having local anesthetic drops on the eye that completely numb the eye. We do cataract surgery like this. So we have people having surgery inside the eye with the same kind of anesthetic drops, which completely numb the eye. So this is not painful. We also use some sedatives, some Valium, which just helps to reduce anxiety. You'll be awake. We want you awake for surgery so you can cooperate, but you will be comfortable, relaxed, and you can talk to me during the operation and we can stop and start as often as we need. So surgery itself, whilst anxiety-provoking as a thought, is actually fine. And the most common comment when we finish is, wow, that was all right. Yeah. People are afraid they're going to go blind. It's your eyes. Vision is precious. It's so important to us all. And the thought of losing vision is just incomprehensible. So people do have a fear that it's not going to work, that it's somehow going to blind them. There's going to be complications, or the laser will malfunction at the wrong time. I get it. The chance of going blind is incalculably small. You know, with laser vision correction surgery, we won't go into detail with complications because it depends upon exactly what we're doing. But to me, the worst thing that can happen will be that somebody will get an infection. And if that's not treated, that could cause a scar which could reduce vision. Now that's extremely uncommon. And the reality is, if an infection looks like it's occurring, if we treat it and treat it aggressively, it's going to go away completely. And that's a rare thing that will happen. Most of the other things that might happen with surgery are things we can deal with. Perhaps we do your treatment and it turns out after 3 months that you can see, well, you're probably going to see 20/20. When we test you, we find it could be even better, then we may choose to go back and do an enhancement, a retreatment. You don't pay for, and a retreatment will just fine-tune the vision a bit further. So it's not really a problem, it's just an inconvenience. So blindness is not really something we calculate as part of the surgery as being a realistic risk. People are concerned at being able to cooperate during surgery. When I tell you that you're going to be awake during the operation and you can talk to me, well, you're going to worry, you're going to blink, move the eye or move your head or do something at the wrong time and ruin the treatment. Well, the lasers we use, the Zeiss system we use specifically, is very sophisticated, and part of that is built-in check mechanisms. For example, the lasers all have eye tracking. When we start the treatment, the laser is monitoring your eye position, a bit like missile tracking systems. And if your eye moves, it'll follow it. If it moves too much or too quickly, the laser will stop. The laser can stop, reposition you, have a chat with you, and then we start the treatment again. One of the fantastic things with the laser vision correction systems is that we can stop and start the treatment as much as we need to. Also know that the actual laser part of the treatment normally lasts for about 20 or 25 seconds. So it's not a long time for the laser to be working. And we're talking to you during this time. You can talk back if you need to. So the chance of you doing something during surgery that damages the treatment is extremely low, if not impossible. If you were to sit up during the operation, the laser would stop. We'd get you comfortable, lie you down, and continue the treatment. Now, of course, people have heard lots of things about this from other professionals, friends, people in the street. And it's a common thing, for example, that people believe you can't treat astigmatism with laser vision correction. Well, you can. That you can't treat long-sightedness. Well, you can. Or my prescription might be too high to have laser vision correction. Yeah, it might be. That's part of the reason we get you in and test you and do a lot of diagnostics before surgery. But if we can't do laser vision correction, then we'll do an implantable contact lens procedure. So it's pretty uncommon that someone comes to see me for whom I can't offer a solution to their visual problems. It's pretty uncommon. Doesn't mean it's going to be laser surgery. I'm not the first one to tell you, you should not have laser. Your eye is not suitable. It is not safe for you. And we'll talk about alternative procedures, which you may or may not do. Sometimes I'll tell a patient when they're in front of me, look, you should do nothing. You should leave your eyes alone. It's a very strange situation. It's not worth your taking the risk to do any surgery. And that's not common, but I would much rather do that than do surgery and have to worry about the kind of bad outcome. People are worried also, of course, that they'll do surgery, but that it won't last. The effect will wear off, and they'll go back to wearing glasses very soon, and well, that was a waste of time. Well, we've now got good data 20 years later. 20 years of laser vision correction using both LASIK and PRK. And this lasts. The vision is stable. I have my own patients coming back after almost 25 years with stable vision. Now, a lot of those people are having to wear reading glasses, and we might be doing another operation to get them out of reading glasses. And some of those patients are getting cataracts because they're now getting into the age group where cataracts become more common, into the 60s. And we're now doing cataract surgery on these patients who previously had laser vision correction. And that's something we've developed a bit of expertise in because, of course, it's nice to be able to offer these patients a multifocal lens implant so that when they come to have their cataract surgery, we can ensure they continue to enjoy spectacle-free vision. But back to the comment that this may not last, it does last. When we do laser vision correction, it's going to last indefinitely unless something very strange occurs with the eye. It is common that as people get to the age of 50, they will come to need reading glasses. This is not because the laser is wearing off. This is because they're undergoing the process of presbyopia, the natural aging process of the eye, whereby the lens in the eye and the muscle that controls that lens can no longer change the focusing power of the eye. And maybe it's too difficult. Maybe it's too much downtime, or maybe it's too painful. But downtime certainly comes up. Now, if we do smile surgery, for example, typically by the next day you can see the function and probably drive a car without glasses. And because we have not disturbed the surface of the eye, you can pretty much do what you want. I tell you to stay out of the water for only a week just to reduce the risk of infection because there is a small wound in the eye. But you can go back to most activities within a day or two of surgery because there's no flap to be concerned about on the surface of the cornea. So there's not a lot of downtime with this. We do both eyes at the same session. So you'll be in surgery for about 10, 12 minutes in total. You'll go home. By the next day, you should be seeing well enough to function and look after yourself. An interesting area of conversation is to think about whether contact lenses in the end are just safer than doing laser vision correction surgery. This has been looked at for about 15 years because people want to know. Patients want to know. They want to know, is it safer for me to continue wearing my contact lenses, or in fact, is it safer for me to do laser? Now, sometimes it's obvious. The patient comes in today, I saw a patient who's had 3 ulcers in one eye over the last 12 months with contact lens wear. Well, his eye is suffering. His eye is telling him it doesn't like the lack of oxygen that it suffers with contact lenses in the eye. So for him, it's going to be a safer option to do something like laser to get him out of contact lenses. And the literature supports now the idea that laser is at least as safe as contact lenses. But in many situations, doing laser vision correction, if it's done properly and done well, is actually safer than prolonged wear of contact lenses, particularly for people that use extended wear lenses, where you do get some hypoxia, lack of oxygen in the cornea. So laser vision correction surgery is at least as safe as wearing contact lenses. And in many situations, it is safer to do laser vision correction surgery and get out of the continuous contact lens wear cycle. So what happens when you come along for surgery? Well, you're going to come along and meet one of my staff, and I'll go through questions and answers and work out what you would like, what you need, your eye history, and we'll do a series of diagnostic tests. Now, one of the ironies with this surgery is that the techniques we had when I was doing surgery, we still use. This has been a very stable kind of operation. Now, of course, there have been advances. SMILE, for example, is a wonderful advance. But LASIK, like I had, is still being done, is still a current technique. Where the real improvements have occurred have been in our ability to measure the eye and to understand what those measurements mean, and so to be able to do the right operation for the right patient and not operate on people who shouldn't have surgery in the first place. So we use a lot of complex diagnostic equipment. There's a lot of expense here in setting this stuff up so that we can understand really the shape of your cornea, whether you've got dry eye. We do tear osmolarity, for example, that measures the concentration of your tears, a very sensitive indicator for people who may have dry eye without symptoms. But I need to know that before I do laser vision correction surgery. So you go through a set of diagnostic tests, which will take perhaps 20 minutes. And then importantly, you're going to sit with me and we're going to have a conversation. I'm going to talk to you about the history of your eyes, things that may have happened before, talk to you about the diagnostic tests we've done, what they mean to you, what we found, and how they guide us in our choice of surgical technique, and then present to you what I think would be the most appropriate way to treat you. One of the benefits we have at Bondi is we do all these operations, whether it's PRK, whether it's SMILE or LASIK or implantable contact lens, multifocal lens implant, we do all these things. So we can choose the best operation for the patient in front of us, and we can combine these things to customize it to the particular patient. So we're going to have a conversation. You're going to tell me what you think, what might be your fear about this, or what your expectations are from the vision, so that I can suggest the most appropriate intervention and talk also about expectations, what you can expect to achieve by doing it. This is a very important step to have clear understanding of what we're going to do, why, and how it's likely to work. And then, of course, is treatment. The day of your treatment, you come in, we're using local anesthetic drops, you have some Valium to help you be calm and relaxed, and we do surgery. Now, we have all this set up in our Bondi Junction facility. We have a proper operating theatre with the lasers installed. One of the true luxuries of building an entire new clinic, physical clinic, is that we can design it around the most current technologies. So our laser suite is custom designed for the most modern lasers, including the SMILE laser, which means it's a wonderful, clean, functional space, a very safe space in which to do surgery. And I show these little video snaps just to show that when we have a patient with us, and this is a mock-up, of course, when we have a patient there, the patient is awake, you're awake, you can talk to me. You can tell me, oh, I'm feeling a bit scared, or that's a bit uncomfortable. I can stop and reposition you, give you some anesthetic drops if we need to, and then go back to the treatment. So you're not alone. You can talk to us, we can hear you, we can see you, and we can respond to things you may need during a treatment. Now, whether we're doing PRK or LASIK or SMILE, it's all in this operating space. And we have a couple of lasers there, and we'll use a combination of those for most treatments. And then, of course, after we do your treatment, we send you home, and then we have your long-term follow-up. So we're going to see you after surgery, typically a day after surgery and perhaps a week later, depending on exactly what we've done. And I like to see patients then ongoing. I want to be sure that long-term the results are what we expect. So we either see you ourselves or we work closely with optometry and ask them to send us information about you when they see you each year for routine eye checks, so so that we can maintain information to know the long-term effects of what we're doing. So that's me. That's a long but hopefully useful overview of what laser vision correction looks like. This is quite generic, of course. This is not telling you what treatment you will need. I don't know any of you. I can't even see you yet. The next step really is to come and be measured. Come in for a consultation, have your eyes measured, and once we've done that, we will know what treatment might be most appropriate for you, and we can discuss that with you. The contact details are here, and I welcome any questions you may have. I'm very happy to answer questions now. Thank you.
Fantastic. Thank you, Patrick. That's a really great presentation. Now, we have received some questions through the session, but as Dr. Versace has just said, please post your questions now and we will get to them as we go along. So one of the first ones is, thank you for the presentation. Is there anything that patients can't do after laser eye surgery?
You know, there's not. In the immediate term after surgery, I tell people don't go swimming for a couple of weeks. I don't want you to get an infection in the eye that's got these fresh wounds and it's just healing. So that's the first couple of weeks. And if we do LASIK, for example, where we've made the flap on the cornea, then I tell you to avoid contact sports and to avoid babies' fingers. You know, little babies love to put their fingers in your eye, and if you've got this fresh flap sitting there, the last thing you need is to have that bumped and knocked off. Now, long term, so going out beyond, say, a month, there is no restriction of what you can do. We have pilots, fighter pilots, doing LASIK, for example, with the US Air Force, and they have to be able to eject from a fighter jet at high speed with big shear forces. And they've tested this on animal models to be sure the eye is stable. So there is nothing, there's no restriction long term after you've had LASIK. And as SMILE becomes more and more common, the restrictions are really even less, because you don't even have that flap on the cornea to be worried about.
Thank you, Patrick. Now, the next question that's come through, and I think you've answered this earlier, but the second part, so you mentioned tests and diagnostics before surgery. What does this involve? And is there any wait time after this for surgery, or can it be done on the same day?
Yeah, two answers. I don't like to have somebody come to see me and do surgery on the same day. I want people to have a little bit of time to assimilate the information, to take in what we've discussed, and then make a great decision to have surgery. This is a big deal. You know. To me, of course, I'm doing it all the time. I know how well it works. But for the individual patient, this is a big deal. This is life-changing. So I want to take this seriously. So I tend not to do same-day testing and surgery, unless, of course, there are exceptional circumstances. If someone's coming to me from the country or further away, then what I might do is have them go to the optometrist first and have the optometrist test them with basic tests. So before they come to me, I have an idea of what we're going to be doing. And that sort of situation, we might do same-day diagnostics and surgery. But I'll also say that there's no long waiting time for surgery. We're doing laser all the time because we have it in our own setup. We own this stuff. We can do it as often as we want. So it's never more than a couple of days to have to wait for this.
Thank you. And further on to the surgery aspect, another attendee's asked, can I do one eye now and the other next week, or do I have to do them together? No,
you've got total choice over that. Occasionally, people are more comfortable to do one eye at a time, and that's not a problem. It costs the same, there's no difference, and it doesn't matter at all clinically. Doing them both at the same time is largely a convenience thing, and that's become the standard way of doing it around the world. It's a convenience thing. But it's also nice because your brain instantly gets this kind of vision with both eyes. There's not that kind of imbalance period in between doing the eyes. So we tend to do two eyes together because it's far more convenient, but occasionally people would prefer and be more comfortable to do one and then 1 week later. It's just not a problem.
Thank you. Now I've got two more questions. So I just invite anyone, if you do have a question that you would like to post, please post that. But again, if we do not get to your question this evening, we will endeavour to contact everyone tomorrow. Now the next one is, what refractive error specifically are able to have laser surgery, and what is the astigmatism cutoff?
Yeah, so what I say now is going to be a rough guideline because it depends also on how thick your cornea is, the shape of your cornea. We don't want to make it too steep or too flat, so there are many provisos on this. But as a rule of thumb, up to about -6, -7, is where I would do smile surgery and then start to do an implantable contact lens. We can go to -10, of course, with smile surgery. It just depends on the corneal shape and thickness. But say laser can go to -10. And for astigmatism, it's up to about 5 diopters of astigmatism with laser.
Thank you. Now, the next one's quite a big statement, but I will repeat if I need to. I've spoken to my optometrist about laser vision correction surgery. I've been wearing glasses since childhood. They told me I'm not suitable due to being a premature baby. Has technology progressed and could I be a candidate now?
Yeah, well, it depends entirely on what the issues of the eyes, of course. But we know that if you wear glasses, whatever you can see with glasses, chances are we can give you that with surgery. Now, whether it's with laser surgery or an implantable contact lens, I wouldn't even guess at that without having a chance to look at your individual situation. But we can make this quite simple and say whatever you can see with glasses, we can give you that with surgery.
Fantastic, thank you. Now that does bring us to the end of the questions. So I will take this time to thank Dr. Patrick Versace for your time to present this evening, and thank you to everyone who has logged on. We do hope that you found this session useful and kindly ask that you complete the short survey that will pop up on your screen when the session ends. For more information about how you can start your journey to freedom from contact lenses or glasses, please contact the wonderful team at Bondi Eye Doctors by calling 8080-2180. Tomorrow you will receive a copy of the session this evening, along with the contact details for Dr. Patrick Versace's practice and the team at Bondi Eye Doctors. Thank you, and we hope you have a great evening.
Thank you, Natasha, and goodbye. Thank you all for coming and listening in. That's great. Bye-bye now.